everyone. The cardiac output, which we're covering in this lecture, is defined as the amount of blood that the heart pumps per minute, and it is going to be a key measure of the heart efficiency. As you can imagine, this is going to be vital for maintaining the adequate blood flow and also the oxygen delivery to all the tissues in the body. First, I think it's important for us to define what is cardiac output. Cardiac output is going to be the volume of blood that's going to be ejected from the heart per minute. So there are two factors, volume and time. So the volume of blood, and then how long does it take to eject this amount of blood per minute. There is a very simple formula that we can use to calculate the cardiac output, which basically is the stroke volume, represented here by SV, multiplied by the heart rate, represented here by HR. Stroke volume is the amount of blood that's ejected per contraction. In other words, every time the heart contracts. And the heart rate is how many times does your heart beat per minute. Now remember that the heart contracts and relaxes and contracts and relaxes and contracts and relaxes. And when it relaxes, this is when the heart will fill up with blood, right? So you have the passive filling up of the ventricles with the blood that's coming in through the atria. And remember that relaxation is called diastole. Now, right at the very end of relaxation, you will have a particular amount of blood in the heart. And we call this the end diastolic volume, which on average is going to be around 130 mLs of blood. And what happens at the end of relaxation? The heart will contract, right? And this is what we call systole. So at the end of contraction, you will have ejected all the blood that you possibly can, but you will not be able to push all the blood out. There will always be a little bit left over. And this volume is called the end systolic volume, which on average is about 60 mLs. So the end diastolic volume, or EDV, and the end systolic volume, or ESV. Therefore, we can say that the stroke volume is going to be the end diastolic volume minus the end systolic volume, which in this case, on average, is usually 70 mLs. But the stroke volume is every time the heart contracts. And this volume, of course, might change from person to person, but on average is about 70 mLs. And how about the amount of beats the heart does per minute? Well, of course, this will also change from person to person, but this is what we call the heart rate. And on average, this will be about 70 beats per minute. Therefore, if we have 70 mLs of stroke volume and 70 beats per minute for heart rate, we're going to have a cardiac output of approximately 4.9 liters per minute. And therefore, this is your cardiac output, which is the volume of blood that's ejected from the heart per minute. So every minute, your heart is able to pump almost 5 liters of blood that will be circulating throughout your body. Now, there are three main factors that will contribute to stroke volume. We have the venous return, filling the heart, the contraction of the heart, and the ejection of the blood from the heart. Let's talk first about the venous return, which will be filling the heart. So this just means that it's the blood that's coming from the veins, so venous return, and filling up the heart. More specifically, we can say that it will be filling up the ventricles passively. So the atrioventricular valves will be open and the blood that's coming in from the systemic circuit into the right ventricle, will be able to fill up the right ventricle. And once the heart is going to be maximally filled, meaning that all the blood from the venous return is inside of the ventricle, we will call this a preload. So the preload is going to be the stretch that the blood places on the ventricle walls when it is maximally filled. So the most amount of blood that can enter into the heart will cause a stretching of the walls of the ventricles. And why is this important to know? Well, because the preload is going to be directly related to the amount of blood that actually gets ejected due to something that is called the Frank-Starling law or Frank-Starling mechanism, which basically means that the more you stretch the heart wall, the greater the reflexive contraction of the heart will be, which means that the more blood that gets ejected. And this is beautiful, right? So the preload is actually going to directly be related to the stroke volume. And preload is directly related to the venous return. So the more you stretch the heart, the greater the contraction, the more blood can be sent into the systemic and the pulmonary circuits. How about the contraction? What do you need to know about heart contraction? We have seen already that the contraction will be dependent on calcium, right? Because the heart is a muscle and muscle needs calcium to be able to contract. You can have factors that will promote or inhibit calcium, and these are called ionotropic agents, and they will be either positive or negative. The positive agents are going to be the ones that will increase the availability of calcium. So for example, you have noradrenaline or the parathyroid hormone will be able to increase the levels of calcium. And the negative agents will decrease the availability of calcium. And these can be, for example, any drug that is a calcium blocker, or even if you're having some sort of electrolyte imbalances. So these will influence the contraction rate due to the availability of the calcium ions. And lastly, we have the ejection of the blood from the heart, which is actually called afterload. So when the blood gets ejected from the heart, it will encounter some resistance. Therefore, this means that the wider the blood vessel, the lesser the resistance. Makes sense, right? Or the opposite, the narrower the blood vessel, the greater the resistance. Therefore, we can say that afterload is the resistance that the blood experiences as it leaves the ventricle. As an example, we can use individuals that might have atherosclerosis, where they develop plaques in the walls of their arteries, which will narrow the diameter of that artery. And this will therefore increase the afterload, which means that it increases the resistive force that the blood is experiencing as it's leaving the heart. If this is the case, then less blood gets ejected, and the stroke volume will then decrease as well. Therefore, we can conclude that the afterload is actually going to be inversely correlated with the stroke volume, because if you increase afterload, it means that you are increasing the resistance, and therefore there's going to be less blood that will be ejected, and this therefore decreases the stroke volume. How about heart rate? What can affect the heart rate? Well, mainly the autonomic nervous system and the two subdivisions, which are the sympathetic nervous system and the parasympathetic nervous system. And these are going to be called chronotropic agents, where chrono means time. So it is timing of the contraction. When will the contraction occur? And the basic heart rate is established by the pacemaker cells of the SA node, but this intrinsic rate can be modified by the autonomic nervous system. In other words, the SA node will initiate the heart contraction, but the autonomic nervous system will be able to either increase or decrease the heart rate. So the sympathetic and the parasympathetic divisions of the autonomic nervous system will provide the innervation to the heart through what we call the cardiac plexus. Both autonomic nervous system divisions, they will innervate the SA and the AV nodes as well as the coronary arteries. And in addition, the sympathetic nervous system will innervate all of the cardiac muscle throughout the heart. This means that the sympathetic nervous system will have a greater influence on the heart rate. The parasympathetic system, it will arise from the branches of the vagus nerve, and when they act on the heart, they will decrease the heart rate, as the parasympathetic nervous system is responsible for the rest and digest. With regards to the sympathetic nervous system, it will arise from the cervical and upper thoracic chain ganglia, and since this is the fight or flight, it will increase the heart rate and also increase the strength of contraction. When will the influence of the autonomic nervous system take place? Well, basically, there's going to be certain information concerning the status of the cardiovascular system that will be arriving at certain cardiac centers that actually monitor, for example, blood pressure, or they can monitor chemoreceptors, and these will then send a signal through these pathways to either increase the heart rate or decrease the heart rate. In other words, these centers, they will respond very quickly to the changes in the blood pressure, to the amount of dissolved oxygen and carbon dioxide that are present in the arterial blood. So for example, if you have a drop in blood pressure or an increase in carbon dioxide concentration, this usually indicates that the heart must work harder to be able to meet the demands of the peripheral tissues. So therefore, the cardiac centers will then respond by increasing the heart rate and the force of contraction by activating the sympathetic nervous system.